The villagers of Rihan rev up their generator so a mobile clinic can screen their blood for anemia. It's an engine that generates partnership also. Care International runs clinics funded by the European Commission's Humanitarian Aid Department and provides the only source of basic healthcare for this isolated Palestinian community. More than a dozen nervous Palestinian schoolchildren line up for a quick jab in the finger, and except for one little boy who's not so happy, they are stoic about these blood tests. Ever since the Israelis built a separation barrier, queuing up has become a way of life for 350 residents of this enclave. This is an area where the barrier has been built inside the 1948 Green Line, leaving a significant section of the West Bank on the Israeli side of the wall. But it also disconnects Palestinian families living in isolated rural villages from family and jobs in the West Bank. Palestinian residents of the enclave are unable to cross the old Green Line west of their village to enter Israel. But even if they go east and queue for hours, many are delayed or prevented from visiting the rest of the Palestinian territory. Preventative health checks are essential for the Palestinians who live in this area, including heart patients and the elderly, since their chances of making it to a hospital in time for essential treatment are very low. Ambulances coming from the enclave are not allowed to move across to a West Bank hospital without a lengthy inspection, and from 10 p.m. till 5 a.m. the gate at Barta'a remains locked shut, and this is where Care steps in to provide a life-saving service. 25 patients turn up every Thursday to the mobile clinic session funded by the European Commission. Dr. Muqtada Jabarin, who travels from the West Bank through the checkpoint to bring medicine to the Rihan clinic, can never predict how long his journey will take. On relatively quick days, he can get through in 30 minutes, but sometimes 2.5 hours are wasted while the guards break open every vial of drugs and examine each roll of bandages. Sometimes entry for his van, clearly marked humanitarian aid, is refused, and at the end of the working day, the doctor must go through the checkpoint routine again to return to Jenin. Since Barta'a villagers have no access to a pharmacy inside the enclave, this mobile clinic is the community's sole source for asthma inhalers, insulin, contraceptives, allergy pills, even Band-Aids and aspirin. It also provides vaccinations and flu shots. Now they are effectively marooned in this tiny hamlet, which receives no services from either the Palestinian Authority or the Israeli government. On average, there are only 3 hours of electricity per day here. Barta'a checkpoint has created a geographical and bureaucratic nightmare for this little community. The mobile clinic is the only lifeline for Palestinian families trapped in this locked down and increasingly desperate community.